Welcome. My name is Edward Hooks, and this is Get Hooked on Wellness. Today, we have the honor of learning from a clinician with more than 21 years in primary care. She specializes in lifestyle and weight management. And just to make sure that everybody's clear that this is an educational program, it's not advertising nor are there any endorsements. So, if you have any personal health care advice or decisions you need, please consult your own clinician for that. So, for our special guest that we have here, I have to say thank you very much for joining us.
You're
Uh,
welcome.
could you share a brief snapshot of your own background, where you practice, and the communities you have served in the past?
Sure. My name is Dr. Alexandria Hooks. I am a doctor of nursing practice and board certified family nurse practitioner. I've had the pleasure of working over 2 decades in family medicine in rural and urban communities. I've served all sorts of diverse populations from different backgrounds and cultures and traditions. And the most important thing to me, so the audience knows, is that my primary emphasis is focusing on compassion and practical coaching, to help individuals achieve better health outcomes.
Nice, nice. Well, for something that I like to personally touch on, we're going to go into exactly what lifestyle medicine is because our viewers, they don't probably know exactly what it means. So, could you please explain to the audience exactly what is it you mean by lifestyle medicine?
Certainly. Lifestyle medicine is an evidence based approach that uses therapeutic lifestyle interventions like nutrition, physical activity, sleep. We also address stress management, social connection, and avoiding risky behaviors. And this is to treat, prevent, and also reverse chronic conditions. And this is actually defined by the American College of Lifestyle Medicine and supported by the Ornish Lifestyle Research Health Trial. The main takeaway is that this shows significant reversal of coronary heart disease through these lifestyle changes.
Okay, that is very, very interesting to know. Um, So, could you also please explain for the to the guests who are viewing that exactly what chronic heart conditions do, and how you most often address these types of conditions through lifestyle intervention, and what kinds of outcomes matter the most?
Certainly. We most often address things like high blood pressure, diabetes, heart disease, and significant improvements in blood pressure, A1C, cholesterol, and weight have been demonstrated in specifically the diabetes prevention program, the Look Ahead trial, both funded by National Institutes of Health.
So, in practice, what are the core pillars that you would like to emphasize, and how do you tailor these to cultural, family, and work life realities?
Well, as I alluded to before, we emphasize things like nutrition, movement, health, stress management, sleep, relationships, and avoiding substances. And actually, the Harvard School of Public Health recommends tailoring interventions to each person's cultural, family, and work realities for better adherence and outcomes.
For viewers who feel overwhelmed when it comes to this subject, what's a realistic first week plan that would respect their limited time and budget?
That's a great question. My biggest recommendation is to start with small, achievable goals. Take baby steps. For example, add 2 servings of vegetables a couple days out of the week for week one. Week two, add 3 servings of vegetables for each meal for week two, and so on and so forth, and gradually build upon that. Same thing with adding more water each week, adding more exercise. Start with just 10 minutes of walking 1 day a week for week one, 10 minutes of walking twice a week for week two. The whole point is that these incremental changes, which are actually recommended by the Center for Disease Control, are supported by the professionals' follow up research study, which showed that stepwise interventions or improvements in health really does matter.
I would like to move forward and talk a little bit about weight management medicine versus weight loss programs. So, you specialize in weight management. So, how is medical weight management different from a short term weight loss program?
Great question. Medical weight management treats obesity as a chronic relapsing disease, not simply an issue with willpower. The Obesity Medicine Association and American Medical Association recognize obesity as a disease, and it's influenced by genetics, hormones, and the environment. And as a matter of fact, the Step 1 research trial demonstrated statistically significant weight loss using FDA approved medications combined with lifestyle interventions.
Okay. So, what makes obesity a chronic relapsing condition rather than just, willpower?
Obesity basically involves complex interactions between genes, hormones, the environment, and according to experts, the FTO gene study published in 2007 and the Look Ahead research trial published in 2013 both showed that long term support and medical care are needed for sustainable results.
Where do medications and meal planning and resistance training, all those things that we've heard about, and behavioral change, how does that all fit together?
Well, we continue to use these tools to support sustainable weight management, not just short term or a quick fix. And this is actually recommended by Harvard Medical School and the Step 1 research trial. They show that medications plus lifestyle changes provide greater weight loss rather than one or the other alone.
So, how would you, I guess, set expectations around pace or change when people reaches a plateau and long-term maintenance?
I think people need to have patience.
Mhm.
Progress takes time. Again, it's not a quick fix. The National Weight Control Registry tracks over 10,000 individuals and shows that slow, steady weight loss and ongoing support are keys to long term maintenance. Again, it's not a quick fix.
That is very, very good to know, and I believe that most of our viewers should know these things. Um, when a patient says, you know, I just want a quick fix, how do you reframe them toward a metabolic health and sustainable habits?
That's a great question. Oftentimes, we get patients in who their primary motivation is to lose weight quickly to get ready for some upcoming event like a wedding or get that beach body or just for vanity's sake. But we try to shift that focus to metabolic health and sustainable habits, as highlighted in the diabetes prevention program, which actually found that small, consistent lifestyle changes are actually needed to reduce diabetes risk by 58%, believe it or not,
Wow.
and other chronic health conditions.
Wow. So, one of these questions I was thinking about, what are three high impact practices that you would recommend most often for the average adult to improve energy, mood, and metabolic health?
Well, these high impact habits include eating more whole grain, plant based foods, move daily, even if it's just for 20 minutes, and prioritize sleep and stress management. I can't emphasize that enough. The Nurses Heart Health Study and the DASH research trial actually both found that behaviors significantly improve metabolic and mental health.
So, what does balanced nutrition look like in real life, especially for people who are balancing cultural specific foods, family meals, and tight budgets?
That's a great question. A balanced diet includes vegetables, whole grains, lean proteins, healthy fats that can be adapted to culture and budget. The Harvard Healthy Eating Plate and the Prairie Med study both supported this approach for heart health and metabolic health.
So if someone, let's say, only has 20 minutes, to dedicate towards a healthier lifestyle, what's your go-to approach to preserve muscle and reduce visceral fat risk?
I must define visceral fat first. That's the fat that we find around our organs, which, when it's high, it significantly increases our cardiovascular risk. Things that we can do to help with that are brisk walking, body weight exercises. Both of those are very effective. And as a matter of fact, the Harvard Health Study reported in 2018 and the Stride Research Study reported in 2004 found that moderate intensity activity reduces visceral fat and preserves muscle.
Okay. Well, how do you help patients that are linked to poor sleep, have a very stressful lifestyle, and that induces cravings and glucose variability and just weight regain?
Well, poor sleep and high stress increases cravings and glucose swings. The mental ill study reported in 2007 and the research from the University of Chicago both showed that sleep deprivation raises hormones and the risk of weight regain.
Really? Mm, I guess sleep really matters. So, you're passionate about mental and spiritual being. Why is this dimension so important in health and prevention?
Well, I strongly believe that mental health and spiritual health are both foundational, they're fundamental. And as a matter of fact, the American Psychological Association and the Duke University Center for Spirituality, Theology, and Health both reported improvement in health outcomes are significant when mental and spiritual needs are both addressed.
Okay, so what signs tell you that it's time to bring in a mental health person, a clinician, a chaplain, or some community resources?
Well, when mood, motivation, or stress issues persist despite lifestyle changes, a referral to a mental health professional is recommended. The American Physician Association in 2019 highly emphasizes that as well.
Okay, so how does mindset and values help people stick with nutrition and movement changes when motivation dips low?
Well, growth mindset and value based goals improve adherence. Dr. Carr Dweck's research at the Stanford University, published in 2006, and the Studies in Health Psychology, published in 2017, actually confirmed this.
Okay, so for our viewers out there of faith or even not of faith, what principles help people build consistent, compassionate self care?
Self compassion and purpose support self care. Self Compassion Research Lab in 2011 and the American Physician Association show improved health and resilience when you practice self compassion.
Mhm. So, everybody, you really need to start thinking more about being more compassionate to self. So, we're going to move forward and talk more about body composition analyzers, which are some tools that are used out there today, and what it means and why it helps. So, my question for Dr. Alexandria is, you also use professional body composition analyzers. So, let's unpack the metrics and how they become actionable.
That's a great question. At my clinic, Hooked on Wellness Consulting, we do actually have an in body 580 body composition analysis scale. It's the latest model that's out there on the market. And the way this equipment works is that it uses electrical impedance to measure things like total body water, which guides us in hydration and recovery. It measures skeletal muscle mass, that's key for longevity and glucose control. It also measures body fat and it helps us focus on sustainable fat loss. It also measures that visceral fat that I was talking about earlier that makes you higher for heart disease. And by doing so, it helps us guide the patient in reducing aerobic and guide them in interval and resistance training. Basic metabolic rate is also helpful, a measurement that it provides to us that informs us on nutrition targets. And segmental lean analysis helps us personalize exercise plans. We also have a phase angle measurement that reflects cellular health and also recovery. So, not everyone should get this scan. I would actually avoid if you have an implanted cardiac device, are pregnant, or unless you're cleared by a clinician, you should avoid this measurement using this product according to manufacturer guidelines.
Okay, thank you for that important information. So we're going to do something really quick. I call it the myth versus truth. We're going to try a little rapid fire, and I want you actually to tell us what is the difference between these myths that people may believe, or if they really are true, what these people believe when it comes to living a healthier lifestyle. So, are you ready for this?
Yes, sir, I
Okay.
am.
So, my first question, you can spot reduce belly fat.
That is absolutely a myth. Overall fitness is actually the key. According to the STRIDE research trial and the American Council on Exercise, confirm that spot reduction is not effective.
Okay, because I've definitely heard of, especially actors and actresses, trying to target that one muscle in their stomach. But I guess an overall workout is actually what's best for people. All right, my next question, more sweat equals more fat loss.
That's actually a myth. Sweat is not fat loss. The University of New Mexico showed that fat loss is due to caloric deficit, not sweating.
Yeah, well, I remember back in the day, people putting trash bags around their garments and trying to go run in the middle of summer. That's very scary. So, next question: carbs are always the enemy.
That is a myth. Whole grains and fiber are actually beneficial. Researchers from the Harvard School of Public Health found that diets rich in whole grains reduce chronic disease. Our body needs some carbs. That's how we fuel our brain and our body for energy.
Hmm. Well, this is one of my questions because as we get older, it's harder to lose weight. So I've heard that metabolism is fixed after 40.
That's another myth. Muscle movement and nutrition keep metabolism flexible.
Mhm.
According to Potzer et al. Science published in 2021, they found that metabolism remains stable from ages 20 to 60.
I lift weights, I'll get bulky.
I have to say that's another myth. Strength training is essential for everyone. According to Scofield and Cunny reported in Sports Medicine Journal in 2010, they found that resistance training improves health without exercise or excessive bulk.
Yeah, that was a question I had because I know a lot of people who won't exercise with free weights and only do cardio. And so, thank you for busting that myth. All right. If I can't be perfect, it isn't even worth starting.
That's a myth. That's unfortunate that people have that mindset. Progress is fundamental over perfection. The Dweck study shows that incremental progress leads to long lasting sustainable change.
That's good to know. So I know many people that have, so many responsibilities. You have some people who are taking care of loved ones. And so when it comes to self care, they think that self care is selfish. Is that true?
No, that's a myth. You really can't take care of someone else if you're not at your optimal level of wellness. Your cup will be empty if you continuously give and give until you have nothing else left. So it's important to practice self-care because it enables you to care for others. According to the American Psychology Association, they confirm that self care improves well being and relationships also.
Thank you for the information and thank you for my little rapid fire questions. So I would like to move on to, getting started safely. Okay, so for someone beginning a lifestyle and weight management uh, type of regime, what are the first things or three things, the first three things you'd have them do, say, starting this week?
So, definitely number one, I would say start with one nutrition habit, like adding vegetables, one movement focus, walk daily, one sleep or stress routine, set a regular bedtime. The Diabetes Prevention Program and the Ludwig at Harvard actually support these practical first steps.
Good, good. So how do they know when to involve a clinician, a registered dietitian, or a mental health professional?
Involve a clinician, registered dietitian, mental health professional, any sort of licensed healthcare provider if you have a chronic condition, a mental health concern, or need personalized support after practicing self care and you still have ongoing persistent issues. This is the standard of care recommended by the Academy of Nutrition and Dietetics and the American Physician Association.
All the information you provided today has been very, very good. I hope the viewers had an opportunity to gain some knowledge out of this. So, again, thank you for sharing your experiences. And remember, evidence based lifestyle changes, nutrition, movement, sleep, stress, and connection can prevent and even help reverse many chronic conditions. So, please talk with your healthcare provider before making changes.